So I'm going to give a brief talk about NASH and FibroScan. So a little bit about us is we were founded in 1999 by a former ER doctor, Dr. Reardon. I don't know if you guys have met him or not. But anyway, our mission pretty much is to provide compassionate care to our patients, much like you guys do. We also provide reliability to our sponsors and commitment to excellence. That's our mission. We have multiple trials enrolling. Benefits for the subjects or patients, there's obviously no cost for them, and there is a financial benefit for them. They get treatment-related medical care at no cost, and there's no insurance necessary, so many of our patients are either underinsured or not insured, much like what you guys are kind of, the care you guys are providing as well. Pretty much our bread and butter studies or actions. So I'm not going to talk too much about the specifics of NASH, as you guys probably already know quite a bit about it. But you know, it's non-alcoholic fatty liver disease. Basically, you have a fatty liver. But there's really no other secondary causes of that. It's broken down into NAFL, which is you have fatty liver, but there's no inflammation. NASH, you also have fatty liver, but there is some inflammatory processes, either transaminitis, elevation of liver function tests, that kind of thing. So progression of disease is basically a normal liver, you've got to get fat deposits. You get fat deposits, you get some inflammation, you start to get fibrosis. And worst case scenario is they end up eventually progressing to cirrhosis from the disease process. A lot of factors into this. Primarily, it's thought to be insulin resistance is the kind of the common denominator. There's some suggestion that there may be a secondary kind of insult, some kind of oxidative stress, kind of pushes somebody over to having fatty liver disease. And the conditions that are associated with it are obesity, type 2 diabetes, dyslipidemia, metabolic syndrome, hypertension.
So everything we see.
Everything we see, yeah. So you provide good care for your patients. It's pretty much an asymptomatic disease already on the course. You know, anecdotally, for 10 years we get CAT scans down in the ER, and probably about anywhere from 40 to 60% of those patients got a CAT scan on the day. Fatty liver, fatty liver, fatty liver. And it's all over the place down, especially down this area here. So now it's kind of interesting coming full circle down on the other end of things, trying to find a solution for this. Anyway, as the disease gets advanced, you can get jaundice, all the kind of stigmata that you might have with cirrhosis. The diagnosis, you may see a lab kind of, what we call incidentaloma or incidental finding on CAT scan or ultrasound or MRI. Right now, the liver biopsy is considered the definitive way to diagnose NASH or NAFL. I think we're quickly moving into the realm of other modalities. I'll talk about FibroScan later, liver biopsy as a modality to diagnose NASH. So this is our FibroScan machine. We're fortunate to have one. We've had it about 6 months now. It kind of looks like a fancy ultrasound machine. It's got a couple different small probes on it.
Looks like a robot, man.
Yeah, it does. Kind of
come
like
at you.
Yeah. That definitely looks like a robot.
Rotomax. Robot.
Yeah. So it's basically the first FDA device to aid clinical management of patients with liver disease. One advantage it has over liver biopsy is that basically 100 times the surface area of a liver biopsy. Liver biopsy kind of go into a very small sample. This kind of goes through, you get a much bigger sample, so your sample size is much bigger, so it kind of leads to more cleaner diagnoses. Basically, it provides two measurements. The first one is going to be what we call this kilopascals, or this E-score. And that is a measurement of liver stiffness, liver fibrosis. We'll talk a little bit more about that in a second. From
So
that
the pressure
score,
then, right?
Huh?
A Pascal is a unit of pressure, correct?
I believe so, yeah. It has to do with like propagation of this kind of shear wave, that's kind of vibrational shear wave that goes through the liver. And then from that, you can calculate this, basically your call this controlled attenuation parameter, CAP score. These are non-invasive ways to kind of measure fibrosis and your fat content in the liver. So you have these probes. Basically, they're kind of like a little button on there. You kind of go in between some intercostal areas here between 9 and 10. It kind of feels like maybe like a marker tip that's kind of pressing against your skin. It's basically quick, pretty painless. You take about 10 quick measurements. It calculates from those measurements, gives you these scores. Size probes. We don't bother with pediatrics since we're not doing any research in pediatrics. Again, this is kind of what it looks like. If there's a little probe there, you press it against the kind of quadrant. You get actual real-time calculations on there. It'll tell you if your measurement's good or poor.
Finger on the patient.
I think is this the same one you guys have there in front of you? This is what kind of comes up. There's your measurements here. These are your scores. This is the most interesting one here. Is your E-score or kilopascals. This is the CAP, kind of the fat measurement. So basically fibrosis, fat measurement. And then the rest is kind of not terribly important for our purposes. So what do you do with that score? You get this E-score. This is what we're most concerned about. You get, it's 8.7. So kind of depending on your disease, so we're concerned about NAFLD. You take that score, you plug it in here, 8.7. It gives you kind of an estimation of what your fibrosis score may be in relation to like a biopsy. So if you have a biopsy of the same patient, it will tell you that it's moderate disease over there, as long as you align it with the disease process. And they're kind of vary for each disease, from alcoholic liver disease up to C, Hep B. So you got to kind of make sure you exclude all the other diseases first, and then plug in your NASH patient with those numbers. Kind of another way to look at it here. So your E-scores, according to these Medivir scores up here, which kind of a scaling in terms of liver fibrosis. Going back, this is kind of how we do it. I made up a fictional patient, George Harrison, was my favorite Beatle. So again, our score is 8.7 on the kilopascals. The E-score, basically, you plug it in here. 8.7 is above here. It's fibrosis stage 3, so it's moderate to severe. Kind of gives us an idea of how much disease has progressed in this patient. So what can your patients expect? Well, we ask them to be in VO 3 hours prior to the exam, because eating can alter the score. It takes about 10 minutes at the most. They wear loose clothing because again, you're kind of like an ultrasound access that require area. 10 quick measurements, kind of get an estimate of liver stiffness and fat. How are we treating this disease? Well, there's really no good answer at this point. Weight loss is really the only proven kind of safe and beneficial treatment at this time. There's numerous of other treatments, metformin, vitamin E, nonalcoholic acid, all kinds of them. None of them have been shown to be terribly efficacious, panned out so far. Recommendations are, if you have somebody with non-alcoholic liver disease, that they get vaccinated for Hep A and B, avoid alcohol consumption, try to optimize their glucose control, treat any hyperlipidemia. And it sounds like vitamin E is only for advanced fibrosis in patients without diabetes or coronary disease. So it doesn't leave a whole lot of other options. So that's kind of why I think, in generally seen as kind of significant amount of money and time being poured into NASH because no one really has a good way of managing this at this point in time.
Sorry, good question. And since the vitamin E patient without diabetes?
They're saying it's only indicated for advanced fibrosis without diabetes and without coronary artery disease. Still with that, that's something I'm putting up to date, and I don't have an answer for you, I understand. But, my impression before I'd gotten into this is that the vitamin E was kind of across the board to be considered safe. I apologize, I didn't go into the details about that. So right now we have at our 3 sites about 3 or 4 different NASH trials ongoing. We started our first one about a year ago, and that one's completed.